Good morning, welcome to Chris O'Brien Lifehouse in Sydney, Australia. Today we're going to demonstrate how efficient our surgical team is. We have 8 thoracic surgical cases, including robotic thymectomy, robotic wedge excision of lung tumor, right pneumonectomy, and 5 thoracoscopic lobectomies back-to-back between 2 theatres. So it's already 8:30. We better get started. So this is the second case of the day. Patient had induction chemotherapy and she's undergoing radical right pneumonectomy. The patient has very central tumor in the right hilum that was biopsy proven to be adenocarcinoma. She had induction chemotherapy because she has a very small R4 lymph node that was biopsy proven to be a N2 disease. And for patients with single-station, low-volume N2 disease, at our institution, they undergo induction chemotherapy. This is the third case of the day. We're doing a robotic wedge excision of a pulmonary metastasis in the right lower lobe of the lung, a young guy who had a previous sarcoma. He has already had the left-sided resection done about 4 weeks ago and recovered quite well, and now we're going to do a right-sided resection. So this is our 4th case. The patient is a 76-year-old man. Quite a obese man. He has got a non-small cell lung cancer in the right lower lobe of the lung, in the posterior medial segment. The tumor is actually quite sizable tumor. There is no hilar or mediastinal lymph nodes involved on the PET CT scan, and the tumor is in biopsy proven to be adenocarcinoma. So we're going to do a thoracoscopic right lower lobe lobectomy. This is a 60-year-old lady with a biopsy-proven neuroendocrine tumor in the left lower lobe of the lung. And after the biopsy, she had a pneumothorax, therefore she had a chest drain inserted. Now she's having a thoracoscopic left lower lobe lobectomy. This will be our 5th case. At the moment it's 2:20 in the afternoon. We just finished our 5th case, which is the thoracoscopic left lower lobe lobectomy. The operation took about 30 minutes. We're going to move on to the next door, okay, which is also a thoracoscopic lobectomy. So this is our 6th case. The patient's got a biopsy-proven right upper lobe tumor, which is adenocarcinoma of the lung. The patient has multiple comorbidities, including ischemic heart disease. The patient had myocardial perfusion scan, which showed previous inferior wall infarct. Also, patient diabetic, hypertension, hypercholesterolemia, and also has COPD. The plan for this case is to do a thoracoscopic right upper lobe lobectomy. The tumor is in the posterior segment of the right upper lobe. I'm going to do this thoracoscopically. Okay? So we're going to go on to the 7th case. Most people have not taken a break. Have you taken a break? Except Tracy, she's had 3 lunches already. So this is our 7th case, which is a thoracoscopic lobectomy on a 83-year-old lady who had biopsy-proven non-small cell lung cancer in the basal segment of the left lower lobe. Her lung function is pretty good, and she will tolerate a lobectomy. So this is the last case, the 8th case of the day. It is a gentleman who's got a mixed ground glass lesion in the right upper lobe of the lung that has been enlarging over a period of 6 months. So the lesion has been biopsied to be a non-small cell lung cancer. The plan is to do a thoracoscopic right upper lobe lobectomy. It is our last case, the 8th case of the day. We're running a little bit late, but everyone has been working very hard, running 2 theaters. So far, all the patients who had the operation have been quite good. No evidence of bleeding. The drainage output is quite low, and they're very comfortable in the HTU. And some of the patients are on the ward. So it's almost 6:30. We finished all 8 cases. So it's a day of solid work involving our nursing team, anaesthetist, and also Jamie Santabanez, my assistant, and myself. We've done 8 cases. So getting everyone together and to say bye to you all. Just hold the patient down. I just like to really thank everyone who put so much work into today's patients. We overall done 8 minimally invasive thoracic cases, including 2 robotic cases, 1 radical pneumonectomy, and 5 thoracoscopic lobectomy between 2 theaters involving everyone here. I think we have a very efficient team at Crystal Bryan Lifehouse, and really thank everyone for your hard work. Okay.